Around the globe, the devastating impact of climate change is increasingly clear. What may be less obvious is that it is also making us sick, some of us even more than others, by contributing to more disease, asthma, heat deaths, and mental health impact. But there are things we can do to address the climate crisis and improve the health of those we love, our families, and our communities. Today, climate and health champions join us around the table, and together we'll chart a path forward for better health for all.
Welcome. I'm Dr. Kurth, President of the New York Academy of Medicine. Thank you for joining us today. Today, we're releasing the latest in NYAM's popular Around the Table series. Since debuting in 2021, this series has covered a variety of topics related to health equity, which is the heart of our mission here at NYAM, with specific relevance to the times we're living in today. These have included conversations on vaccine confidence, transgender health, the mental health of frontline health workers, the future of clinical education, and many more topics. This year, the series will focus on the connection between our health and climate change. Each program will bring together climate and health champions to discuss what can be done about the climate crisis, which is a health crisis and a health equity crisis, and provide resources to inspire us to take action and help make change. I look forward to having these discussions with you and getting insights to achieve better health for all. Our program today introduces the connection between climate change, the climate crisis, and health. The climate crisis is a health crisis. We want to tell the story around what's been called by many the largest public health crisis we're facing today that affects human health everywhere. About a month ago, the world's key collection of scientists working on climate change, the IPCC, reported that we need to accelerate action, that taking action will have co-benefits for us, and that we have multiple options to reduce our greenhouse gas emissions and help us adapt to human-caused climate change. As more and more people in the US and around the world are appreciating the climate crisis is happening now to people, not just polar bears. It affects all Americans, though not equally. So it affects the health of people we love and our communities. There are things we can do, and health workers, in particular, are trusted sources of information and action for this work. So today we're going to hear from two guests, Dr. Ed Maybach of the Center for Climate Change Communication at George Mason University, and novelist Stephen Markley, author of The Deluge, a modern epic about the climate crisis. Both guests will explore how we can help to tell this important story, the story of our time. I look forward to both conversations and to sharing with you all. First, to discuss the importance of taking action to increase awareness of the health harms associated with climate change and raise awareness of the health benefits of climate solutions, Dr. Ed Maybach. Dr. Maybach is a distinguished professor at George Mason University and leads their Climate Change Communication Center, as well as working with weathercasters and helping lead the Medical Society Consortium on Climate and Health, a consortium of 37 medical associations across the US. In 2021, Ed was identified as one of the world's top 10 most influential scientists working on climate change, and we're thrilled to be in conversation with him today. So, welcome, Ed. Thank you so much for joining us.
Thank you for having me. Such a delight.
It's great. So, listen, I've heard so much of your work, appreciate it all, and one of the things that I've heard you say before, aside from the polar bear quote, which I did take from you, is that you said, as health professionals, addressing climate change is in our lane. This is in our wheelhouse. Tell us more about how you reached that conclusion and why.
Yeah, thanks, Anne. It's a topic I've thought about a lot because as a public health professional, first, foremost, and always, somebody who's been in the discipline for 42 years now, I talk to a lot of our fellow health professionals about climate change, and many of them, they're concerned, but they don't really see that this is our issue to deal with. And I have reached the opposite conclusion. I feel like this absolutely is our lane, and I'd like to try to frame that up for you and for your listeners. You know, when I did my public health training back in the early 80s, this was the era when we were everybody was so excited about the behavioral determinants of health, right? The fact that that so many of the leading causes of morbidity and mortality were largely preventable if we could just help people change their health behavior. And the enthusiasm about it was just palpable. During my MPH program, Bill Castelli, I believe he was the medical director of the Framingham Heart Study. He came and he talked to us, and talking about the learnings of the Framingham Heart Study, and it was absolutely heady. I was so thrilled, and that was what I launched my first decade of my career thinking about the behavioral determinants of health. But then in the 90s, everything started to change. And we started to think about the social determinants of health, because we realized that so many of those behavioral determinants were largely driven by the social determinants of health. And so if we in the health professions, and public health in particular, wanted to get to the root causes of ill health, we had to focus on the social determinants. But now, over the past 15 years, as a health professional working on climate change, I've come to see it differently yet again. The ecological, what I call the ecological determinants of health, most importantly, but not exclusively, a stable climate, are even more fundamental, because when we disrupt the ecological determinants of health, they have these pervasive, terrible consequences on both the social determinants of health as well as on health directly. So if we really want to get at the root causes, get to the things that can eliminate preventable morbidity and mortality, we really have no choice but to deal with those ecological determinants of health. Again, in my opinion, the most important of which is stabilizing the global climate. Let me give one more elaboration on that. For most of my career, I was trained to see, I was taught to see, and I have seen tobacco as public health enemy number one. But now that the world is catching up and we're actually running different analyses on preventable morbidity and mortality, it's really clear that just on an apples to apples basis, morbidity and mortality from burning fossil fuels is far greater than morbidity and mortality from tobacco use. So, and that's only one of 8 health impacts of climate change, is through worsening of air pollution. So just taking one of 8 impacts of climate change on human health, it's really clear that burning fossil fuel is a profound enemy, not only to our climate, but to our health and well-being. So that's why I do what I do, and why I'm very much focused on the ecological determinants of health, and why I'm hoping that many more of our colleagues will also recognize that really is what we most need to focus on. And that's why I've concluded that this is our lane.
Great. I really appreciate hearing that trajectory. I feel similarly about it, and really expanding our viewpoint to recognize how interconnected we are to ecosystems. And that's what all health relies on, including human health. So, I've also previously heard you say that health professionals need to jump in quickly to occupy this lane. Say a little more about that, the time, urgency, and why now?
A great miracle happened in 2015 when almost every nation of the world came together at the Paris climate talks, the COP, I guess that was COP 15 or whatever number it was, the Paris climate meeting. And they agreed, and at this point, 194 out of 197 countries have ratified the Paris Climate Agreement, which the goal of which is to limit global warming to no more than 2 degrees centigrade. The wording was a little bit different, but the no more than was the important phrase there, no more than 2 degrees. And shortly thereafter, the leaders of the world asked the climate scientists of the world, the IPCC, which you referenced earlier, they asked them, well, is 2 degrees of warming safe? Is that the right goal? Because that's the goal we have just ratified worldwide. And, I believe it's actually the first worldwide goal of any sort that had ever been ratified by almost every nation in the world. So I do consider it a great miracle, and it's the best thing we got going for us. But I'm glad that our leaders also went back to the climate scientists and said, is 2 degrees safe, or would 1.5 degrees be better, smarter as a goal? And in 2018, they released their report, the IPCC special report on 1.5 degrees C, I believe was the title. And it was like all of IPCC reports, it was very detailed. It was based on rock solid science. And what they concluded essentially was that every 1/10 of a degree of warming above 1.5 degrees C will carry with it grave public health consequences. In other words, no, 2 degrees of warming is not safe. It really shouldn't be the global goal. We should recalibrate that global goal to 1.5 degrees C of warming, because every 1/10 of a degree above and beyond that will have grave public health consequences. Unfortunately, the world is not likely to actually achieve that the limiting of global warming to 1.5 degrees C. And unfortunately, in addition, lots of people have reached some very dire, really doomist conclusions, feeling like we're screwed. We're not going to achieve the 1.5 degrees C. We probably won't even achieve the 2 degrees C. But the right way to interpret the IPCC's findings is that every 1/10 of a degree of warming that we do manage to prevent is a profound gift to the health and well-being of our children and our grandchildren and their children and grandchildren. And so that's why I think it is so urgent for us health professionals to jump in now, occupy the lane, work as smartly and as effectively as we are capable to shave as many 1/10 of a degree off the top of the warming trajectory as possible.
I really appreciate your breaking it down that way to what sounds like somewhat more achievable. Relatively small scale differences can have outsized impact on health improvement and reduction of illness and preventable death, as you say. And that's what we're all about as health workers, isn't it? So thank you for that. And of course, also we know that there is a need to take action, in this next decade or so, and really pull in all of those tools that we know we need to, both to mitigate, to reduce greenhouse gas emissions, to be more environmental in the way we approach our modern life, including healthcare delivery, as well as to, frankly, be more prepared for the impacts that will happen inevitably, even as we move towards more change. In advocating for all of that and telling the story of what we can, should, and must do, there are a number of voices already in the climate space, in the environmental space, in the health space. What makes our role as health providers and health advocates unique?
We have done a lot. My colleagues in my Center of Climate Change Communication, because we are the host of the Medical Society Consortium on Climate and Health, as you said a moment ago, we've done a lot of communication research to try to figure out how can we use our trusted and caring voices to greatest effect to try to turn the trajectory around and to accelerate the world's I consider inevitable progress towards decarbonizing our nation society and the global society. And all of the research that we've done have really confirmed for me that we have a unique role to play. In part, our unique role is because we as health professionals, we are among the, if not the most trusted voices in every community in America and in every country around the world. Polling data shows this time and time again. Even, I know it doesn't feel this way for many of our health colleagues, we all feel very beleaguered by how badly the COVID pandemic was handled, especially here in America, but we still are among, if not the most trusted voices in every community. And that gives us a unique opportunity, because trust is one of those assets that there is no substitute for. And trust is an asset that cuts through in times of great confusion. So part of it is the fact that we have trusted and caring voices, therefore people listen to us. Part of it is that we have a very powerful narrative, a very powerful story to tell to members of the public and to policymakers, a story that for the most part, they haven't previously heard. I love the fact that you picked up on my exhortation that we talk about climate change as a people problem, not a plants, penguins, and polar bears problem, because that's what most members of the public have heard. Climate change is a threat to polar bears. Okay, we get it already. We've seen the pictures 100 times. Yeah, I get that. But what most people haven't heard, or haven't heard enough to start them thinking about it, is how climate change affects their health, their children's health, their parents, their neighbors' health. And our research shows that when we present them with that kind of information, it heightens their sense of personal relevance of the issue. Most Americans, 7 out of 10 Americans, accept that climate change is real, but they see it as a distant problem. Distant in time, space, and species. Distant in time, 2100, sure. 2023, not so much. But in fact, the epidemiology shows many Americans are already having their health harmed by global warming. Distant in space, Bangladesh, sure. Boston, maybe not. And distant in species. Polar bears, yes, people know. So we have the opportunity to reveal to people, perhaps for the first time, that your skin in the game, quite literally, is your skin, your health and well-being, that of your children, that of your family members. And that heightens perceived personal relevance. The second reason why we have this unique opportunity is because we can talk about benefits of climate solutions that pay dividends immediately in terms of better health and well-being. The reality of the benefits of climate solutions, the climate benefits of climate solutions, they will happen decades from now. So as we do the right thing and we clean up our energy supplies in my community, my state, our nation, that's a good thing for the global climate many decades from now, and everybody around the world will benefit a little from it. But the health benefits of climate solutions are profound, and they are immediate, and they are local. So when my community shuts down the final coal power plant in our area, it's us here in my community. We're going to be the primary beneficiaries in the form of cleaner air, cleaner water, and better health. Our asthmatic children will be less likely to have serious asthma attacks, fewer hospitalizations, really profound benefits that we all care about. And we here in our community are the primary beneficiaries. So we're not just doing the right thing for everybody worldwide. We're primarily doing the right thing for us. And our colleagues in the field of behavioral economics tell us that their main conclusion from behavioral economics research is that people don't like to put money out today for benefits that accrue in the distant future and accrue to other people. So as we as health professionals talk about the health benefits of climate solutions, it makes it personal. It brings the benefits into the present and into our own community. And that's really, that changes everything. And there's one final thing that our narrative changes, which is perhaps most important of all. The climate and health narrative is most effective, most engaging with our conservative brothers and sisters, our conservative community members. They are a group who have been reluctant to really listen to the scientific narrative about climate change, to the environmental narrative about climate change. But our research has shown really clearly that they're very interested in the human health narrative about climate change, and they see a lot of benefits, a lot of value to the health benefits of climate solutions. So that really encapsulates why I think we have a unique role to play. We not only make all the solutions seem so much more compelling, but we actually have the opportunity to get our friends on the left and our friends on the right having a real conversation about how we want to address this challenge to our community, to our country, and to our world.
Yeah, I have to say I was really inspired. It brought me a sense of hopefulness given that we live in such polarized times in our country and around the world, given that there often is a kind of pushback against science, to say, no, this is an element that has universal appeal, that we all want to leverage ways to help our own families and communities that we love, and that there is, in a sense, a way to have that common ground. So I found that very inspiring from your work, and the application of that in this current kind of time of way we all communicate. And of course, all of us interact with healthcare. One of the points that's been made by some of our colleagues has been, let's try to get more prevention out there so that we reduce our use of healthcare overall. That'd be one way to green up our healthcare delivery. But the point is, we do all interact with health and public health over the course of our lifetime. So again, it is health workers in that space who will interact and be able to hear the stories and tell the stories that are relevant to people both living with illness and being affected by climate change impact. So there is a power to that I think we, again, mining our motivation for why many of us became health workers in the first place is to provide that kind of support and help. Now, I will address, though, the reality that you brought up, which is health workers are exhausted. Health systems are strained. We've come through a pandemic and are still in it, not very gracefully. And many health workers feel like they were not always supported effectively in that crisis. As we think about the additional crises that will come our way with climate change and all the human-induced interactions with microbes and pathogens. How do we think about, really supporting health workers to feel like this is part of what I do? I'll give you an example. I was giving a talk on climate change with some nursing students, and God bless any student who goes into healthcare these days. I thank them for it because they're wonderful, glorious professions, but not easy ones. And this nursing student said to me, okay, I hear you. Yeah, okay. I'm supposed to fix all the social determinants of health. I'm supposed to deal with COVID without PPE. I'm supposed to take on all the social ills that our society doesn't do. And now I have to fix climate change. And I thought, okay, fair enough. How do we address the needs of health workers to be supported in learning more about how to integrate this into their work and how to then move forward with it? Can you talk about some of the, I know you did a survey, a global survey of health workers to get some of the attitudes and some of the barriers. Can you talk about that a bit?
Yeah, happy to. And the nursing student who you're speaking to, I mean, I really think that what she was articulating is a really valid and important point. But I would say back to her, given the opportunity, look, I'm not asking you to work alone in isolation to take on the world's biggest challenges and opportunities. I'm asking you to join your fellow health workers in doing so, because when we link arms together as health professionals and we lean into important problems that are best solved with smart public policy, the way in which we can be most effective is working together. And many hands makes light the work, right? So it can seem overwhelming, but I would contend it mostly seems overwhelming when we as individuals think about, well, how am I as an individual going to do all of this? So we just need to think more about we as opposed to I. And so that's my first answer back to her is, look, join the climate and health movement, okay? There are lots of organizations who are working to support health, to network health professionals so we can work together to address the root causes, and working to support them with educational materials and educational experiences and advocacy alerts. Really important, okay? We will let you, if you will join our movement, we will let you know when there's an opportunity for you to use your trusted and caring voice to contact your elected representatives to endorse smarter public policy than what we currently have. So that really is, to me, the answer is we got to work well together. We need organizations that will support us in working well together. And fortunately, those organizations they already exist. They are becoming more mature, more effective. And I'd like to point out three, if I may be a little self-promotional and point out three, all of which I have some direct connection to, but I'll point out some others that I don't. As you said, the Medical Society Consortium for Climate and Health, you can just Google them on the web and go right to their sign up page. And they will send you, I mean, they have all kinds of education. We have all kinds of educational materials on the website, but you can also give us your name and email address, and we will let you know when there are advocacy opportunities, both with your federal representatives as well as with your state representatives. So that's one group. We have worked with 25 different states, have sort of organically created a state clinician for climate action, or in New Hampshire, for example, they call themselves the New Hampshire Health Workers for Climate Action. They go by different names, but they have, in New Hampshire, they've got 5,000 or 6,000 health professionals who are working together to influence New Hampshire state policy and local policies across the state. And again, it's all premised on many hands makes light the work. We can be much more effective in championing smart public policy when we work together. And then at the global level, because let's not lose sight of the fact this is a global problem, and the biggest opportunities to address the problem require global transnational cooperation. So a group I serve on their board called the Global Climate and Health Alliance. They also maintain a database of individual health professionals in countries around the world, and they send out action alerts when there are easy actions that you can take, often in a few seconds or minutes of your life, that will really help put your trusted voice behind smarter public policy that's being proposed.
Great resources. I can add a few. The Alliance of Nurses for Healthy Environment are undertaking a campaign to educate, tens of thousands of nurses who are the largest health, members of the health workforce in every nation, everywhere. Healthcare Without Harm has international branches and helps health systems think about greening up their hospital purchasing and healthcare delivery. One of the strategies that I think, look, let's be realistic about what can motivate us is if we are counted or credentialed for it. So I think it's interesting that we are seeing more movements in some arenas with getting some of this content, learning about climate change and health into pre-service education, as we're medical and nursing and other health profession students. And some of the accrediting bodies are now requiring that to be part of the competencies that our health professionals are trained in. There's continuing professional development or continuing education modules after people are already out and practicing, so that we can sort of self-learn in an easy way. I'll just make a pitch. There's a Yale Coursera course for practicing health workers that's free, for example. So I think there are these increasing opportunities for some of us as we enter the health professions to get educated in this as part of our training. And then for those of us who are already out and practicing and working, some other opportunities, as you say, to come together and know that we are in a collective and that we do not have to do it on our own, but that individual encounter within the four walls of a clinic where we might assess for someone what's going on with their asthmatic child. Do they have an air conditioner for their elderly parent, grandparent? Will they be safe in the next heat wave? Those individual clinical actions, that is part of what we do. And as we also are out there in our communities working with the resilience of our communities and in public health, that really is part of our work, and there are an increasing number of tools for that. So thank you for that. Are there any other good examples of health worker and health system and public health system action in this space that you think we should be aware of?
There's so much, and it's developing every day. So I didn't prepare like any specific things to point out and give shout outs to, but it's really impressive, including a testimony last week to the Senate. And I'm blinking on her name. I'm a little embarrassed now, but I've never met her, but I watched her testimony, which was just brilliant. And so she was one of a number of people who were giving testimony, and she was doing it from our lane as a health professional, and she occupied it brilliantly. And I'm absolutely convinced it was perhaps the only person giving testimony in that session that really will help people think differently about the nature of the problems we face, and help them come away with the conclusion that the faster we take action, the more we benefit. Part of the problem is this antiquated notion that doing the right thing to decarbonize our country and our world is the expensive thing. And and it's the difficult thing. In fact, the economics are such that the faster we make the change, the more we save. But it's certainly true when you add on the health and the health economic aspects of the situation as well. So I encourage all health professionals to do whatever they can to educate the public, whether the public is just members of your family or whether it's your next door neighbor over the back fence, this weekend, or at your local the basketball court at your local school, or whether they take on a more formal role, work with Citizens Climate Lobby, for example, to give a community session on the health aspects of climate change and the health benefits of climate solution. And perhaps most importantly, when you have an opportunity to meet with policymakers, be they members of your city council, county council, your state representatives, or your federal representatives, jump in and do that. That is such important heavy lifting that it really doesn't have to be hard, but what it accomplishes is so important.
And telling that story is such a human thing to do. It has such impact and ripples even in small ways in our own smaller spaces, but they can become concentric. And then interacting with policymakers, they do take the words and the experiences and the wisdom of health workers seriously. And there is that respect that can be leveraged in that way. We have a number of resources, links, and information on our site related to this discussion, so people can click on that afterwards. But I do want to just ask you, Ed, as we wrap up our wonderful conversation here, are there 2 or 3 things that you think we can do, either as individuals or as a collective, that you would prioritize?
Well, on top of all the other things I've talked about, joining the movement, educating the public, educating policymakers, there's one last thing that I think is really important. And for so many different reasons, not the least of which is it feels good. And that is, let's lead by example. Let's decarbonize our own lives to the extent that we can. I'll tell you some of the ways that I've done it. I travel much less for business because I found that the pandemic taught me that, gosh, I can do almost everything as effectively via transporting myself electronically into different conversations. And the benefit of that is I'm saving all kinds of money for my university, my research center, saving all kinds of wear and tear on my body, and which is really great. And I get to spend more time with my family, which is also really great. So cutting down on needless air travel, huge benefit. We have decarbonized our transportation in terms of what we drive. Not everybody can do that, although the IRA Act of 2022 is making it a lot more affordable for people to get rid of their gasoline burning vehicles and move into electric vehicles. They're so much more fun to drive. So that's another thing we've done that I've really enjoyed. And then thirdly, it took a few years, but we've completely decarbonized our home. We've got heat pumps that heat and cool our home and are run on electricity. The electricity is produced by community solar. I live in a very shady place, so I can't have solar panels on my home, but I can buy into a community solar plan in my community. And the hardest thing, because of supply chain problems, was an induction cooktop. I got rid of the methane stove that I used to cook all of my children's meals on for many, many years. And now that they're out of my home, I'm afraid I wish I had done so when they were still in my home, but now we've gotten all of that out. So I'm no longer polluting the air that we breathe when I cook a meal for my family. And I'm telling you, it just feels good. It's saving me a boatload of money. It's improving the quality of my life. And it allows me to engage as a climate and health advocate, knowing full well that I've done what little I can do to clean up my own life and my own way of living. It's just a drop in the ocean, but it gives me a lot of, esprit de corps, feeling really revved up by the whole thing and knowing that, yeah, it's a little bit of work to do these things, but boy, that the benefits are, you can't really appreciate how profound the benefits are until you take those actions. And I think it makes me a more effective leader or educator when I spend my time trying to educate others.
It's great to walk the talk. It's great to have positive benefits from the energies we put out into the world, especially in this very, stressed time, cooking that meal on your induction stovetop, if it's more plant forward rather than red meat, and for a family size that might be smaller than in previous generations. Living in a city, we're lucky in New York to be in a very dense city, which is more energy efficient and have the option for public transport. All of those things do make a difference, as you point out. Working to make our hospitals and our healthcare delivery systems more energy efficient as well. It is not only the right thing to do, the cost-effective thing to do over time, but it also does make us feel good. And it's important, I think, to end on that. So thank you for that, Ed. Thank you so much for all the work you do, and we'll stay in touch. Be well.
Thank you so much.
Thanks again to Dr. Maybach for the insightful discussion on the important role healthcare workers have in addressing the climate crisis, which is a health equity crisis. Now, I'm very excited to welcome our next guest, Stephen Markley. Once again, he's the author of The Deluge, what's been called a modern epic about the climate crisis. Mr. Markley will discuss how he chose to tell the story of the climate crisis in a way that's powerful and enlightening and still hopeful, providing multiple perspectives from a range of very different characters that almost anyone can find a way to relate to. So welcome, Stephen, and thank you for joining us.
Thank you for having me.
Great to see you here. Thank you. So look, to start off, can you tell us the story of how you came to spend, I think, almost a decade of your life, right? Telling the climate crisis story, preparing for it, writing it. How'd you decide to educate yourself around the issues?
Yeah, just, when I was a young man in college, I started to see the climate crisis as the defining, event of my lifetime, right? And so I think as somebody who wanted to tell stories, be a storyteller, I was looking at what would become one of the great dramas of human history and sort of mapping that out in my head and trying to figure out how it would unfold became sort of this really gripping project. And even though it took me forever to finish it, it was something I could never quite look away from.
Oh, I like that phrase. And the power of storytelling is so salient. So here at New York Academy of Medicine, we're working towards helping health systems, public health systems, and communities become more resilient, be able to adapt to the stresses of the climate crisis. This is one of those many intersecting challenges that such an existential threat poses, to use kind of a trope, but a reality. In your book, these complex issues are presented most clearly by one of the key characters, Asher El-Hassan, who writes executive summaries and policy debriefs that take the place of chapters. I loved the character of Ash. Can you tell us how you came upon this way of delivering very detailed and accurate climate science to the reader in a way that everyone could understand and relate to?
Yeah, I knew I needed a character who was going to be able to communicate sort of like, the technocratic detail of all this. Like, I think everybody kind of vaguely knows the term climate change. They vaguely understand what's happening, but the details of it are so wonky and so sort of like policy oriented that I wanted a character who could deliver that, but in a way that was unique, in a way that like kept the reader sort of gripped by his own internal deliberations and his own psychology and the way he looked at the world. And so Ash was sort of the vehicle for delivering a lot of that information.
Yeah, it was very, very effective. One of the health impacts of climate change that is happening around the world, particularly in places that contributed the least to greenhouse gas emissions, ironically and unfairly, is the issue of reduced food quality, and famine itself, which is happening, especially in places like sub-Saharan Africa, that, again, contributed the very least to the problem of the climate crisis. How did you decide to do this episode through the experience of Ash and his son?
Yeah, so I knew that within the context of the plot of the novel, there was going to be a food crisis. Like, one of the way I sort of wrote the book was looking at the science, looking at the trends, and then seeing how the characters would react to those trends. So it was almost like I was putting the fireflies in a jar and shaking it up, right? Ash comes upon this moment where the world is really crunched in terms of its food supply. And we've experienced some of that, this past couple of years. Not anything as severe as is in the book, but still pretty bleak. And I think what I wanted to demonstrate was just like the sort of sheer insanity that surrounds our system of food production, how precarious it is, and what that precarity means, not specifically in the Western world, although that is a problem, but also for, the developing world, and how that crisis can hit so immediately and be so severe and so dire and lead to a host of other issues, in terms of resource conflict and war and all that other, those kind of terrors.
Yeah, thank you for that. Certainly food is so basic and, such a human need. And I think the other thing that you did very well in this novel is to talk about the political implications, because when there is resource scarcity, when there is that kind of tension, it does lead to strife. And so we see it, even increasing temperature has been shown to lead to increased interpersonal and intrapersonal violence and political strife. So I thought you captured that in a way that was very relatable, particularly as a parent, to watch a child not have the food they need. So very, very powerful. And it goes,
I was just going to say, I think like one of the aims of the novel was to dramatize not just, the obvious things we all know climate change does, not just the fires, the floods, et cetera, but also sort of the less talked about implications, one of which is the, food crises, the other of which is, vector-borne disease, health issues, public health being under threat. So, you look at something like Lyme disease and the way like the range of ticks has spread across the eastern seaboard of the United States, right, and into the Midwest. You look at malaria, you looked at all these various health issues that we don't necessarily connect to the climate crisis right away, but which are being influenced. So I think that was a big a part of the goal of the novel, was to demonstrate that sort of 360-degree sensation of what it will feel like to live inside of this.
Really powerful. And, it goes to that point about novels being empathy machines and exercises in empathy. But thank you also for bringing in a health aspect, because it's still rather remarkable to me as a health professional that people don't always make that connection to health. Even people who are in the climate change space, they talk about transport and electrification and food. And often the health sector is this afterthought at best. And I guess I try to remind myself that really it's only been in the last 5 years or so, since some of the recent COPs, that people even put health onto the agenda of the climate change crisis. And so, again, we think it's really timely to be able to say, yeah, this does affect human health. There are benefits that we can get, health co-benefits to making these changes. Health workers are really important for helping to be trusted voices around this storytelling. And now is the time to do it. So I want to turn to the balancing act that I felt you did in this book. And I think each of us as humans who care about our families and our communities and the planet itself wrestle with. And that's that there was sometimes in the book a sense of doom that pervades the events of the deluge. I mean, necessarily, you are playing out events that are happening now as well as what will happen in the near term. And there also were elements of hope and of action. So do you think the inability to imagine the full threat of climate disaster allows people to tune it out? And then how do you yourself, or you hope for the readers, combat that feeling of dread to move towards action?
Yeah, this is like an endless debate in the climate community of like, scare people, don't scare people. I just kind of arrived early at the idea that like, there is no sugarcoating this. There is no putting a gloss on it, putting a happy face on it. Like, it really is, I think the most dire and important thing to happen in human history, maybe since like the invention of the atom bomb. It's like that level of existential risk we're facing. And so there's really not a way to write a novel about it and give it anything but its, the most dire, urgency that it deserves, right? So that's the first part of that answer. The second part, though, is that I do get very frustrated by doomerism, or this idea that there's nothing that can be done, that we're all screwed, that, capitalism is a force that's going to, wreck the planet. There's nothing we can do about it until we blah, 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 right? It's my sense of the thing is that we are actually in the most crucial moment, because we still have time to do something. I, like many people, was very heartened by the passage of the Inflation Reduction Act this past year, and what that promises in terms of developing renewable energy and other sources of power that will not burn fossil fuels. We obviously need to do a lot more, and we need to start thinking about, and this is where I think public health comes in, adaptation and what the planet's going to look like, even as we approach 1.5 degrees centigrade of temperature rise, right? And so I think rather than looking away from this crisis, the book should force people to look at it and sort of live their lives with it. Like this is something we, our children, and our children's children are going to be living with for, as far as the eye can see. So we need to start thinking about these things and including them in our public discussion, our politics, our media, our culture, our novels. And I guess that's just sort of the way I approached it while I was writing.
Yes, thank you for that. I really do believe in that power of blending, the humanities with the sciences. That's the full human experience. The book ends with a kind of a flashback in which one of the lead characters, Kate, who's a very compelling climate activist, goes hiking with her partner, Matt. At first, he says, no matter what ideologies arise, what myths we embrace, what technologies we invent, what dreams we offer, this crisis is effectively our eternity. Similar to what you just said in some ways. But after they make it to the top of the mountain, Matt looks at Kate and says, I could easily believe that each and every one of us carried this thing she had, a dormant seed of the wild within. I could believe that this great sickness would one day pass, that we would begin again and carry across impossible time the glory of this ancient and magnificent world. The stories we tell ourselves and each other are crucial. As the historian Yuval Noah Harari said recently when writing about artificial intelligence, stories have propelled humanity throughout history. So after writing The Deluge, Stephen, I have to ask you, which story of despair or of renewal do you think is right?
Oh, well, I'm just obviously such a sappy person that of course I believe in, I wouldn't be doing this. I wouldn't have spent 12 years writing this book if I didn't believe, I would do my little tiny piece of putting my shoulder down and helping any way I can with whatever skills I have. So I'm always like, of course there's, opportunity to change the direction that we're headed into, and I think that's also something that I want to get across is that the climate crisis is so frightening, but as a character in my book puts it, it is the keyhole. It is the opportunity we have to build a more just, equitable, and prosperous world, right? Mm-hmm. Like so often climate action is sort of framed in this way of what we have to give up, what has to be taken away from us in order to succeed. And I think that's exactly wrong. Like the world, all of these hardworking people are trying to build is something that feels more bountiful. And I think that is the North Star that we all should be looking towards as we move forward.
I love that. Here at New York Academy of Medicine, equity is our North Star, and you're exactly right. There is the opportunity here that not every generation, almost no generations really get a chance to seize, which is to turn the tide of human history. So thank you for that reminder and that optimism, pragmatic optimism. We have a number of resources, links, and information on our website related to this discussion. But I want to ask you, Stephen, what do you think are a couple of things that we can do as individuals or collectively?
Well, look, I think, of course, in this day and age, politics gets a very bad name and a very bad rap, sometimes for good reason. But becoming involved, especially at the local level, is incredibly important. Doing that, putting those building blocks in place at this base level is going to create the foundation for bigger movements. We obviously have to get back to the federal level to pass more legislation. We really do need that. But one of the strategies that has emerged right now, especially with the passage of the IRA, is to crush demand for fossil fuels. So what does that mean? It means getting natural gas, methane gas, out of our built environment, out of our stoves, out of our homes, out of our home water heaters, all that stuff. And there are policies we can pass. In LA, they're working at it right now. And I think like when people look at their local politics, it's such an ignored part of public policy that there's so much room to affect change there. So, I mean, I would just implore people to get involved and to make this, not like you have to go out and hit the drum beat and march in every single day. It's more like make it a part of your life, like, you know, make it a part of your routine, and just try to live with it as much as you can, I guess. Sorry, this is a very soapboxy Q&A session. I didn't mean to be so.
No, it's good. It's and it does come back to that old adage, think global, act local. And I'll just say again for my own soapbox, there are health workers in every community, in every setting locally. And so there is power there to harness that both for our own families as well as to move the larger system. So thank you so much, Stephen, for your incredible amount of work here and what you have gifted to the world with this book. Please come by the Academy anytime you're in New York, because we have a wonderful medical historical library, and we will put pride of place with this book adding to our library. But thank you for all of your efforts and for being part of this session today. Be well.
Thank you so much for having me.
Very grateful for our two wonderful contributors to the conversation today, telling the story of climate change and health. I want to just summarize if I can. You may have your own takeaways. But some of the things I think we heard today: the climate crisis is here. It affects our health, the health of people we love. Addressing it will save lives and improve health for everyone. Dr. Maybach pointed out that addressing climate change is squarely in our lane as health professionals, and that every moment and every action counts. Steve Markley showed us the power of storytelling with the novel as an empathy exercise. He reminds us that stories drive us as humans. When we think about the story of our time, how the advances of modern life from fossil fuels has come with such cost, with impacts felt worst and first by those least contributing to the problem, we're reminded of the importance of equity as a framework. We need to take action to reduce greenhouse gas emissions and make the green energy transition that will give us all cleaner air, better health, and better mental health. We also need to prepare our health systems, public health systems, and communities to address the health impacts that will happen, including extreme weather, flooding, shifting diseases, and mental health impact. But we can do this, and it will help rewrite not only our own life stories, but that of our communities and of the human future itself. I want to thank you for taking the time to watch, to reflect, and to hopefully take some small step of a call to action that was outlined by our two wonderful speakers today. You can also click on the links at the end of the program here to learn and use that information to engage other healthcare providers, patients and clients, communities and colleagues. Think globally, act locally. There's room for all of us to do that. We'll be back with our next Around the Table conversation soon as we continue our conversation with climate and health champions. Our next program will focus on populations and communities, highlighting the impacts of climate change on the health and well-being of structurally marginalized communities and the need to address climate justice as we work towards health equity. Thank you for joining us. Until next time, be well.